Hello guys, this is me Dr. Kashan Qasit. Today here we were discussing about the ECG. In previous lecture we have discussed the ST segment, then we have discussed the T wave and also the P, Q and R wave. Today we are going to discuss the major complex of ECG, which is the QRS complex. In QRS complex we will be discussing the three important points. Number one is the basics of QRS complex. Then we will be discussing the waves like Q, R and S wave. Finally, we will be discussing the abnormalities of the QRS complex. So let's begin with the first part of the video, which is the QRS complex. The QRS complex is the major complex of the ECG, and this is showing the ventricular wall depolarization. So I'm going to draw here the QRS complex, then we will be discussing the parts or the waves of this QRS complex. So basically this is the P wave, then this is the Q wave, R and S wave, and finally here is the T wave. So this is the basic pattern of the ECG we will be seeing on the ECG paper. So in QRS complex, the first part here is the Q wave. Then the second part of the QRS complex is the major part, and this is the R wave, and finally here is the S wave. When you will see the QRS complex, you will see sometimes this QRS complex is above the isoelectric line. This means when the QRS complex is above the isoelectric line, this is showing the positive QRS complex. This means this QRS complex is positive in the leads looking at the heart from left side. So when you will see the lead 1, AVL and V5, V6, this is normally above the isoelectric line. When you will see the lead AVR or V1 or V2, normally this QRS complex is below this isoelectric line, which means that the QRS complex is negative, and the leads which are recording these signals are looking at the heart from right side. So in sometimes you will see the biphasic QRS complex like in V3 and V4. In these two leads you will see that normally the QRS complex can be above and slightly below the isoelectric line. So this can be biphasic. So these are all the patterns of QRS complex, normal patterns of QRS complex. So coming towards the basics, we were discussing the Q wave, which is due to the septal depolarization. This QRS complex is actually due to the ventricular wall depolarization. The ventricle which is showing this QRS complex is the left ventricle, because left ventricle is 2 to 3 times more thickened compared to the right one. So this QRS complex on the ECG is due to the left ventricle wall depolarization. Coming toward the wave, which is Q wave, this Q wave is due to the septal depolarization. And then come toward the R wave. This R wave is due to the ventricular wall depolarization. And the last one, which is below the isoelectric line again, is S wave, which is due to the base of the left ventricle which is depolarizing. Base of left ventricle which is depolarizing. So first part is downward, and then it is moving above the isoelectric line, and it is upward, which is R wave, and finally here is the S wave, which is again downward or below the isoelectric line. So this was all about the basics of QRS complex. Now I will tell you about the normal duration or the width of QRS complex. QRS complex is normally within the range of 0.08 to 0.11 seconds. So this is the normal duration of QRS complex. This duration is showing in an x-axis. When you will see the ECG, you will see the QRS complex in this pattern, and this duration is in the x-axis, which is normally equivalent to 2 to 3 small square boxes. We have discussed the small and large square boxes on a ECG in the previous lecture. So this is the width of QRS complex, and it is between 2 to 3 or less than, you can say that it is less than 3 small square boxes in the horizontal direction. And when you will discuss the height or amplitude of this QRS complex, this should be less than 25 millimeter. This should be less than 3 millimeter, means this should be less than 3 small square boxes. Likewise, in the amplitude or height, you will say that the QRS complex should be less than 25 millimeter, which means that it should be less than 25 small square boxes. When it is greater than that, which means that there is an abnormality. The last thing we will be discussing here is the abnormalities of the QRS complex. Abnormalities of the QRS complex involves, we have discussed here, the normal duration. When it is greater than or less than this duration, you will say that the QRS complex is abnormal, which may be due to any heart condition, or there will be abnormalities. We will discuss all these abnormalities later. So coming towards the abnormalities of the QRS complex. The abnormalities of the QRS complex involves, number 1, high voltage QRS complex. Then we will be discussing low voltage QRS complex. Then we will discuss third one, which is the abnormality of QRS complex, which is wide QRS complex. And finally, there will be the conditions in which the QRS complex will be in the different shapes, or you can say the variable shapes of the QRS complex. So these are the abnormalities we will be discussing in the upcoming part of the video. Until now, we have discussed the basics of QRS complex. In the next part of the video, we are going to discuss about the abnormalities and what are the causes of these abnormalities, and what are the different clinical conditions in which you will see the abnormal QRS complex on a ECG paper. Hope you like my video. Thank you very much for watching. I'll see you in my next video.